I want to just share with you that the unfortunate accident that happened with your daughter pretty much saved my children, because my husband strapped everything to the wall since probably about my daughter was 2, which was in 2009.
I'm so proud to hear you say that. Thank you for taking the action, because that's the biggest part. People know about it and they almost never follow through. So thank you for doing that, and thank you for sharing that with me. Awesome.
I have one, Carrie.
Yeah.
Before LifeNet Health called you, were you aware that tissue donation is an option for families?
I really didn't know about tissue donation. I knew about organ donation. I knew about organ donation because my mom's a nurse, and so I was around the medical field growing up. I also had the unfortunate, my best friend's husband was killed a few months before my daughter. He was 34-ish, and so we went through the organ donation process, and he donated his eyes, so I knew about things like that, but I didn't understand the tissue piece and the amount of folks that get helped by tissue donation. And I love to hear stories when I'm at, like, I work sometimes with your donor family services, your grief companion team, and I hear the stories of how many people are saved through the tissue donation that happens. And so I've learned about it, but I didn't know about it before.
Okay. Oftentimes we fear calling a mother who has lost a child, worrying that we're going to cause her more pain, anger, frustration. How did you actually feel after receiving our call?
So I was home from the hospital about 45 minutes. I'm going to give you a little bit of background. So when your kid is killed in your home, and they're not killed from something like, they didn't die from a disease, she didn't die from cancer or anything like that, you're immediately the bad guy. So we went straight to the hospital. We followed the ambulance and the police to the hospital. We were allowed a few minutes with our daughter. We knew she was already dead. We immediately got interrogated by detectives and police officers, and we were separated, my husband and I. I mean, it was like a TV show, right? When I got home, I had to tell my children, my 11-year-old, my 4-year-old, their sister was dead. 45 minutes into that, I get the LifeNet call. I was telling people, like, I don't remember a whole lot about the call, except that it never occurred to me to say no. Right? It never, like, I didn't ask my husband for his permission. Like, I'm making the call. She's dead. I can't, like, nothing I can do is going to bring her back. You can take whatever you want. It's pretty much how I felt about it. If you want to know the one thing, like, that I struggled with in that conversation, the one thing that I clearly remember that, like, I wasn't angry about the call. Like, I knew, right? Like, I'm logical enough to know that, like, time is of the essence. But I can remember the person asking me, was your daughter sexually active? I'm like, look, she was 2. No. Like, why are you asking me dumb questions like that? Really? But the person was like, I'm really sorry. I can remember her saying, I'm really sorry I had to ask you that. I know it's horrible, but we have to make sure, like, she didn't experience any abuse or anything like that. That's the only thing I remember feeling like, she's 2, come on. Do I really have to answer if she was sexually active?
Yeah. We hate asking that.
I know you do. I know you do. I'm sure you do.
We do. Did it take you time to fully comprehend what a precious gift you had consented to? Or was it an immediate connection?
It absolutely took some time, but what I would say is, like, LifeNet Donor Family Services is an incredible team. I mean, I felt connected constantly. I can remember getting letters, postcards, medallion from LifeNet. You know, I can remember getting those things. The best thing, though, was getting the phone call on February 13th, 2008. Like, that was the best thing, because then I felt like, I mean, I knew that I had already made a good decision, but then when you just can put that and you can make it real and you can say, her heart valve went somewhere, like that to me was the key where I was like, okay, now it sinks in, right? And I also knew I was part of a, I don't want to say team, but a community. When you go to the LifeNet tree lighting ceremony and you just listen to some of the stories, I mean, like you really feel a part of something that compassionate friends can't make you feel a part of. Like, you know what I mean? Like there's a different kind of connection. None of those other connections worked for me, but like feeling like, okay, I'm here with somebody else who had to make this decision, somebody else's kid saved up, you know what I mean? Like that to me made a difference. And I told, is it okay if I say what I said about the tree lighting
Give us some
ceremony?
feedback.
If I had only one piece of feedback for LifeNet Health, I'm never invited to the tree lighting ceremony anymore. I was invited for 2 years and that was it. I miss it. I miss it. I want to come. I love that. I mean, it's a 2-second opportunity to talk about my daughter and put an ornament on a tree. My best friend sneaks in every single year and puts a Maddie ornament on the tree every year.
I'm gonna make sure you don't have to sneak in anymore.
I mean, so I don't know how she finds out
I'll make
what
it
it is,
happen.
but she does it and she sneaks in and she'll text me and she'll be like, hey, Maddie's ornament's on the tree.
Carrie, I'll escort you in every year. You're a main guy. You're in.
Thank you.
I was gonna say, you do not have to sneak in. We want families to come back from, day one. We struggle every year with how many postcards go out and emails, and that feedback is important.
Yeah, I love that event. I always look forward to that event, and so that would be my only. I mean, only speak first.
First Tuesday in December.
Okay,
6 o'clock.
we'll be there. We'll be there. Thank you for that.
Next to last question.
Okay.
How has being a donor mom helped you during your grief journey?
Oh wow. So I think the connection with LifeNet and the donor family services. The opportunity to share my story with other grief. Other moms that are going through this journey through the Grief Companion program here. I've met a couple of folks that, it's so interesting, right? Because you never just wake up, like I never thought this was gonna be my life, right? I thought I was gonna just live life and have kids and I was all gonna be great. Like every single step of the way, I can remember 6 months after Madison died, a lady that worked for me, I run a call center in Virginia Beach at the time, a collections call center, so not the same kind of work, but same kind of environment probably, right? And I had one of my employees come in and her 2-year-old had drowned in the bathtub. And I can remember thinking like, oh my God, what are the chances that I'm her boss, right? Like I know exactly what she's getting ready to go through. I know exactly what it's like. She's burying her kid before he was getting ready to turn 2. He died a couple days before his 2nd birthday. Like I can remember. Those are the things that I think about now. Being a donor mom, like sometimes I feel like through the people I've connected with, like Hillary West, good friend of mine, through LifeNet, like we have a bond that we can talk about and share things with, but also not just in LifeNet, just in general, just the normal journey of life. So many people are put into my life that experience loss that I would have never been able to appreciate their journey. I would have never been able to appreciate kind of what they're going through. And it absolutely has caused me to take a pause. And we tease, my circle of friends tease that pre-Madison dying, I was Carrie version 1.0, which was, it's my way or the highway. We're doing things just like blunt. I don't care what you think. We're doing, like this is my way or the highway. Version 2.0 post-Madison dying is a way different way of life. It's more collaborative. It's more, how do I think about what other people might be going through? How do I appreciate, not everybody's, what is tragic for some, not everybody's gone through this. So what might be hard for one person is not the same hard for me, right? So it's really taught me how to be patient. I've had to stop and really think and say, oh my God, it's your dog. We're talking about your dog died, okay? My kid died. It's not the same thing, right? But now I have a dog, and now I'm like, I can't imagine life without my dog. So, I mean, there's that. but it, you know, it allows you to have some perspective that I didn't have before, and I'm grateful to have it, and I'm grateful to be there for people in a way that honestly I didn't feel like I had for me, and so it took me, I think, a lot longer and a lot lonelier path. Hopefully other people aren't feeling that lonely along that path.
Thank you. Because this was such a positive, Maddie's donation was such a positive experience for you, what message would you send to our staff in terms of their fear for calling a mom who's recently lost a child?
So, I mean, I think when so for me, it wasn't even a question, right? It didn't even occur to me to say no, but I can imagine that there are other people that are really angry about that phone call, and I think hearing somebody out, and you know, it's kind of like anything. I understand exactly what you're talking, like this I can only imagine, even if you can't, like I can only imagine, right? You guys, I speak to people every single day that are struggling, and like, I feel like you just have to get down and be real with people in the most kind and compassionate way, but I wouldn't want your job. My God, it's hard enough calling people to pay on their past due credit card payment. I can't imagine having to call and ask for an organ opportunity. Like, I can't imagine that. Hats off to you for doing that. I don't even know if I have good advice, Tammy. I know that.
I'm glad we called.
Oh yeah, because I'll show you something here real quick. I'm going to tell you why it matters right here. So I probably should have said this way earlier in the presentation, but you can see our kind of life here, right? Maddie's heart valves, we established Maddie's message, but you see these two things right here? This angel, yellow ribbon. My nephew was 5 when he died of neuroblastoma. Just diagnosed a year after Madison was passed away, and he died in November of 2009. And 6 months later, his dad, my twin brother, was diagnosed with stage 4 lung cancer and passed away 4 months later. So in 6 months, my nephew and my brother died. They don't have their organ donation was not an option, right? And so I say that because I can remember thinking when my nephew was sick, like, the difference between what's happening to me and what happened to my brother when he dealt with his son who was sick was, I immediately knew I had to turn this into something that was going to be helpful. Part of that story is the LifeNet story. Part of that story is her organ donation, right? If I didn't have that, I think we would still have Maddie's message, right? And I would still be able to say, I think Maddie is saving lives because people strap their furniture to the wall, but we know, without a shadow of a doubt, her organs were donated. What a difference that makes, right? And so, I can't imagine have gone through any of this without the LifeNet Health organization.